Great pleasure to introduce the next speaker, who's Anna Vasilevskaya, who's going to tell us about the 18F-Flortaucipir imaging in retired athletes.
Hi, good morning, everyone. Thank you so much for having me here. I will be talking about my thesis project, which is on Flortaucipir as PET tau imaging in retired athletes. And as many incredible speakers today were already giving you lots of information on concussions and chronic traumatic encephalopathy, I will skip most of the background in my presentation. However, I do want to mention that chronic traumatic encephalopathy is a progressive neurodegenerative disease, and currently there are no in vivo biomarkers for it. However, tau specific imaging, so specifically Flortaucipir, has been widely used in Alzheimer's disease, and it is very specific to tau pathology of Alzheimer's disease. However, currently the research in retired athletes is still ongoing, and the specificity to the tau of chronic traumatic encephalopathy is still unknown. And this is why this brings me to the first aim of the current study, which was to examine the effects of abnormal tau burden as seen with Flortaucipir tau PET imaging on gray matter volumes. And we hypothesized that tau PET imaging will pick up the abnormal tau of CT in affected retired athletes and correlate with decreased gray matter volumes. So for the methodology of the first aim, we recruited athletes from contact sports, and the exclusion criteria were neurological and psychiatric disorders, as well as systemic illnesses affecting the brain, or positive Alzheimer's disease markers, which I will go into in a little bit. We also recruited age-matched healthy controls, and the healthy control scans were only used for the MRI portion of this analysis. Finally, the T1 anatomical MRI scan, as well as tau PET imaging, was completed for all athletes. So to control for the presence of Alzheimer's disease pathology, every athlete underwent either cerebrospinal fluid analysis for Alzheimer's disease markers or the blood analysis of phosphorylated tau 181, as this is a more emerging, quite recent plasma-based biomarker for Alzheimer's disease pathology. So I know this is a very busy slide, but just the main takeaway from this current analysis was that each anatomical MRI scan for each individual athlete was controlled for age as well as intracranial volume using the healthy control scans, which basically the output of that was this Zeta score. And as a purpose of our analysis, they were called gray matter W scores, which basically just shows how much the gray matter of each individual athlete deviates from that of an age-matched healthy control. Now, when it comes to tau PET imaging, the tau PET standardized uptake volume ratios, which were normalized to the tau PET signal in cerebellar gray matter, were used for the 80 to 100 minute and 80 to 90 minute post-tracer injection time, and there were motion and partial volume effect corrected. And what I wanted to mention is that for each tau PET imaging, basically these positive and negative masks were created using a previously published threshold of 1.30 CVR. And then those individual masks for each athlete were then overlaid over the gray matter W score masks, and the mean gray matter W scores in PET negative voxels and mean gray matter W scores in PET positive voxels were extracted, and then a paired t-test was done to compare those values. So now back to the participants. So 4 retired athletes were excluded from this analysis because they were positive for Alzheimer's disease markers on phospho-tau 181 and plasma. And 1 retired athlete was an outlier with very high tau PET. So basically, we ended up including 47 retired athletes that were negative for Alzheimer's disease in either or both the blood and the cerebrospinal fluid. So before I dive more into the results of Tau-PET, just wanted to give you a quick kind of outlook on the biomarker concordance between the blood and cerebrospinal fluid. So we had 11 participants who had cerebrospinal fluid or the blood analyzed at more than one visit. And as you can see here, the concordance is very evident. There was one participant here, specifically ID number 4, that was positive for Alzheimer's disease 4 years after the Tau-PET imaging and therefore was excluded from this analysis. So this is right here the characteristics of the included cohort, which again is 47 retired athletes, the mean age of 51, which included 44 males and 3 females. The median concussion number was 5 and included a variety of contact sports. Vast majority of them were football players, which was 33 in particular, but also included hockey players, boxing, soccer, as well as 1 snowboarder. For the healthy controls, which again was used just for an MRI component of this project, we included 54 with a mean age of 50, and it was 41 males and 13 females. And now to the main component of the first aim, and just want to quickly mention that lower W scores values are associated specifically with lower gray matter volumes. And we found that yes, in concordance with our hypothesis, the mean gray matter volume W scores in Tau-PET positive voxels were significantly lower than in those in Tau-PET negative voxels. And then brings me to the conclusion of the first aim, which was that the tau burden as seen with Tau-PET imaging was associated with lower gray matter volumes. Now we wanted to take this analysis further and explore the visual pattern of the Tau-PET signal in the gray matter. And we hypothesized that the Tau-PET imaging would show an increased signal in certain gray matter regions, and specifically in frontal and temporal lobes, as was defined by previous pathological studies. So here the Tau-PET percent positivity was calculated using the following formula, which was the number of positive voxels versus total number of voxels. And finally, the percent positivity in retired athletes was divided into 4 quartiles, resulting in 4 different groups, with the increasing number of the quartiles correlating with an increase in Tau-PET positivity in the gray matter regions. We also wanted to kind of bring some more objectivity to the analysis, and we redid also this analysis using multiple linear regressions to compare the Tau-PET percent positivity as well as the signal intensity in each specific region. So here's what the visualized results look like. And as you can see, kind of similarly to what like pathological studies previously shown, there is quite a high involvement in the frontal and temporal regions. And it seems that with increasing percent positivity, that signal seems to be moving posteriorly. And this is what the results look like with each individual region. So there were 3 regions that did not pass the multiple comparisons test, which was the hippocampus, putamen, and caudate, but the rest of the regions here did find the significant increase between the different quartiles. So in conclusion of the second aim was then that the tau burden as seen with Tau-PET is showing a distinct spatial pattern extending from the lateral frontal and temporal lobes posteriorly. Again, we wanted to continue looking more into this and examine the relationship between the abnormal tau burden and the neuropsychological scores. And we hypothesized that increase in either SUVR values, which is the crude measure of the signal intensity of Tau-PET, or the percent positivity, which is kind of the measure of the spatial extent of the tau signal, that it will be related to decreased performance on neuropsychological assessments. And just kind of to briefly mention this, we had a full neuropsychological battery that each of the athletes completed. And that included memory assessments, speed of processing, and executive functioning. And the composite scores for each of those domains of interest were created by adding similar scores of respective neuropsychological tests for each domain of interest and then averaging them out. Now, here, what I wanted you to focus on is specifically the memory composite score, which was found to be significantly related, and specifically the increased Tau-PET percent positivity or the increased Tau-PET SUVR, which is the measure of Tau-PET signal, was related to the lower memory composite score. But what we found interesting was that the relationship between the Tau-PET percent positive was more strongly associated with the memory composite score. And the conclusion of the third aim is therefore that increased tau PET percent positivity and SUVR values in gray matter are significantly associated with decreased memory scores. However, tau PET percent positivity had a stronger association with memory scores than did SUVR values. So that means that actually it seems to be the spatial extent of the tau PET signal rather than the crude measure of the intensity of the tau PET signal had kind of more severe effect on the decreased memory scores. And then finally, we wanted to examine the association between tau PET and inflammation. As you've heard already today, speakers mentioned there has been previous research already showing neuroinflammatory markers to be increased. And we hypothesized that the tau burden, again, seen with this tau PET imaging, would be associated with increased inflammation in gray matter. So we employed this technique, which was to extract the free water fraction, which is a diffusion MRI metric, and it is a non-specific marker of neuroinflammation. However, previously published studies show that increased free water fraction has been associated significantly with our other neuroinflammatory markers. So then what we did is we extracted the average free water values from tau PET positive voxels and tau PET negative voxels using those same masks that were created previously for the first aim of the current study. And then similar to what we did with the gray matter volume scores, we did a paired t-test to compare free water values between tau PET positive and tau PET negative voxels. And similarly to what we hypothesized, we found that the average free water values in tau PET positive voxels were significantly higher than those in tau PET negative voxels. And for this analysis, the higher free water values specifically were associated with the higher measure of that indirect measure of inflammation. So then in conclusion of our fourth aim is that the tau burden in our cohort specifically, as seen with tau PET imaging, was found to be associated with this indirect measure of inflammation. So then in discussion, of course, without confirmed pathology, there is no definitive way to conclude that what the tau PET signal means. However, results from specifically our cohort show evidence of pathological process, so which is seen both from the gray matter atrophy and inflammation in areas of increased tau PET signal, and an increased tau PET signal is in turn associated with impaired memory functioning. So, of course, the limitations of the current study are the lack of pathology and the heterogeneity of this cohort. And the future directions would include comparing tau PET signal to the pathology directly. And again, I would like to thank all of our many collaborators, my supervisor, my lab members, and all of the participants. Thank you so much.